Our next presenter is the co-medical director at People's Community Health Clinic here in Waterloo, Dr. Sharon Duclos.
Hello, everybody. Well, let me give you an update for People's at least. I'll start with that. So, as everybody else has said, we continue to see sick people. We continue to see sick people in our respiratory clinic. We can continue to kind of go through that emotional roller coaster of what going through a pandemic takes. So I, like Nafisa, may get a little emotional. It's amazing how the pandemic affects people really differently. And thank God there are a lot of people that have not been personally touched by this. And thank God there are a lot of people out there that don't know somebody that has been personally touched by this. But for people who work in the healthcare profession, and for people who have worked in an industry that has had difficulties with working on social distancing, they are the front lines of this. And they've had to go through that emotional roller coaster of feeling the wave that's coming. Initially, you know it's coming. You're watching New York City. You're watching all that you go through, but you're distance away. You're seeing it, but not really feeling it. You feel sympathy. You're like, oh my gosh, that's just I'm so sorry for them. But you're still over here feeling A-okay. And then it gets a little closer. And then it starts to hit your community. And we knew, definitely at People's Clinic, because one of the things that you realize is a large portion of our population are underserved. They're already struggling with so many issues. They're already struggling with so many chronic care issues. And they are the front lines in industries that have difficulty with social distancing. So we knew when this started with travel, we all kind of estimated who was going to be the first person to diagnose the first COVID. I was just like, it won't be at People's Clinic. Our patients aren't traveling. What we knew is when it started, is that it would be a big impact on our patients. And it has been. And so we've gone through the roller coaster of getting ready, of spending hours of trying to change your process. We've gone through the struggle of how do we see someone who has a significant illness in order to help protect your staff. Part of being ill is also helping somebody emotionally and mentally with their illness. And it is hard to help somebody and educate somebody if you can't talk to them, if you're keeping your distance. And so you're constantly trying to juggle helping somebody, but again, working on social distancing. And then we saw the surge. And then we felt that emotional, okay, here it comes. This wave is now coming. Here comes the tsunami. And then you change a little bit more as far as working around how many positions can I change to really take care of this wave of people as they come in. And as you do that, then you're trying to take care of your staff who start to feel like they start to get sick. And so as the wave comes in, then you have a portion of your staff that's out because you're worried about illness and they don't feel well. So you get over that. And then people go into the hospital. And then finally, you start to see the deaths. And I think that's the thing that really gets you, is you see the impact on the family who have to sit at home and can't be with their loved one, who have to FaceTime as somebody is going through one of the most traumatic experiences of their life. We're going to FaceTime. I can tell you, I've never seen that before, ever in my life as a physician. I would have never thought that we would have to isolate people in order to help protect the bigger good. We're asking families of people who have been diagnosed as in the hospital to do the social distancing. That's harder than anybody else when we're asking to do the social distancing. So you see that impact. You see that impact on the community, and especially on an underserved community that have to deal with so many other lack of resources. And that's the part that finally gets very overwhelming. And I know in our organization, that is what we're feeling, and that's what I've been feeling. And it's hard because you start to go through the grief of realizing, again, this is not a sprint, it's a marathon. You have to set your mind to work on your stamina, to not understand how long this is going to go on, realizing peaks and valleys are probably going to happen. Our best resource is going to be a vaccine. For all those doubters, this is what will get us through this. It will be a vaccine to help us get over this virus. So as we start to move on, and the governor announces the opening, now more than ever, and especially in Black Hawk County, the social distancing is so important. And for me, it is, I think about what would the person say to me who just died from this? What would the family say to me who just died from this? How would they advocate helping other people not go through what they just went through? So that's what I think about. So for the other businesses, churches, restaurants, think about your community and think about your actions and think about how you can best serve the greater good and really, really work on social distancing. Because I can tell you, it is a heavy load to carry. And my biggest fear as I encourage my staff to come to work every day and be compassionate and help people, it's my biggest fear is I'm going to lose one of them, and that I have to carry on my shoulders because I'm asking them to do a service that I realize it is very hard. And I'm asking them, I know they've got that pit in the middle of their stomach, and you get up and you come to work and you think, okay, is this the day? Is this the day that the COVID bug is going to hit me? And you think about that every day. We talk about the unusual dreams people have. People are having a lot of unusual dreams because it's just subconsciously in your brain all the time, wondering if today is the day that it's going to get me. So please work on the social distancing. Please help people out so the number of deaths that we have to endure are minimized as much as they can. That's my plea today. Thank you.